I want to also now introduce, on a change of pace, Dr. Andrew Krinsky is going to say a few words about what's going on with COVID and our congregation's responsibilities, what we're doing. This gentleman, along with Dr. Benjamin Sachs, have given so much of their time to this community to make sure we're doing the right things. And I'm honored as your rabbi, and as speaking for all of us, how thankful we are for everything you've done, Doctor. So please, anxious to hear you.
Shabbat Shalom, everybody. Lots of different directions we can go, but I will promise to try to keep this brief. I'm here on behalf of our COVID Task Force Committee, and just understand that as we meet, and we've met a lot, we probably average more than one meeting a month, and that's going back 18 months. It's a lot of meetings, and they can be quite spirited. We're not of one mind, but all we're trying to do is create a safe place for all of you. And that's not as easy as it may seem. It may seem a logical thing for us to try to do, but these aren't logical times, and the coronavirus is not very logical. It doesn't really behave the way we would like it. I'm a glass half full kind of a person, and to prove that, I would say look around the room and imagine where we were a year ago. We were home on Zoom. I think we've come a long way. This is an amazing crowd, and we're together, and we feel safe, and we're just going to try to keep moving in a forward direction. We're constantly talking about all the things that go into keeping ourselves safe from the virus. Fortunately, not only is Israel looking out over our Air Force bases in Syria, but they're always ahead in the science. And a lot of what we are doing in this country, including the recommendations that came just yesterday, I believe, for all people to consider getting a booster vaccine, come from the data, from the science that Israel is able to accomplish. Now, the logistics there are a lot easier than here, sure, but they got a head start. They have one vaccine, but they're constantly providing the scientific information that this country needs to help give us sound recommendations or recommendations to try to move us forward and deal with the virus. If you haven't been vaccinated, I would clearly ask you to speak with your physician about the pros and cons, the pluses and minuses of vaccination. I don't think I'm speaking to a lot of people, so let's switch over to boosters. If you haven't been boosted, same thing. Speak to your physician about the pros and cons, the timing, the need for boostering of your vaccination status. And I'll just finish by giving you, hopefully, maybe a little bit of a simplistic, overly simplistic explanation of why we're boostering. Is that a failure? I don't consider it a failure of the vaccines. I think that from the onset, if you were listening and reading about vaccines, the word booster was there. Boostering vaccines is not new. What's new is this virus, and we're trying to fight it real time. It's kind of like if you were in the middle of a football game making decisions. I mean, you can go by what's happened in the past, but at some point you have to make decisions based on what's happening on the field. And this virus has taken us for a ride. It has. And we're still in the midst of a pandemic. I point to the glass half full here in this room, but you also probably read that in Europe, countries are starting to shut down again. So the pandemic isn't over, but we're not giving up. Now here's the thing with the boostering. In the beginning, we went and vaccinated ourselves. And lo and behold, we were vaccinated to a much higher degree than we had anticipated, and that was a good thing. The number is 94, 95%. And basically those numbers and what we were talking about was the antibodies. Everyone's heard of the antibodies. Let's consider the antibodies the front door. So what those vaccines did, if given properly, is they closed the front door to the virus. While they were closing the front door and you're building up these antibodies, other parts of your immune system are at work to protect you if, in fact, the virus should sneak in, which it does, okay? 95 is not 100. What happened? Why are we talking about boosters? Again, I don't think anyone could predict at the time that the initial vaccines were given exactly when and if we would need boosters, but it happened. Again, Israel ahead in collecting the information to tell us what's happening. The antibody levels drop. the front door cracks open. The virus gets in. What does that mean? Well, in the beginning, we don't know what it means because it's just a bunch of numbers and data. But unfortunately, Israel is able to prove that what it means is that people are getting sick again, not just positive test, not just a cold, but they're getting sick again, and they're going to the hospital again, and finally, they're dying again. And what group of people is hardest hit? The same group of people that was at risk at the beginning. Basically, the vast majority of us here in the building. Those of a mature age, let's put it, and those of us who may or may not have one or more maladies. I myself, at the tender age of 66, also has hypertension, so I put myself in a risk factor above and beyond a lot of the young, healthy people that almost always just get a cold. Herein lies the challenge. So what do the boosters do? So the boosters basically are an attempt to close that front door again. And guess what? Israel and the data is showing that yes, the boosters are closing the front door once again, back up into that 95 range. What does that mean moving forward? I can't say much more because we're still playing this football game real time. I'd like to think, if you can remember, there was I like to be sarcastic, so I like to tell people that there was a moment in time, it lasted about 5 minutes in June, when we were allowed to go to restaurants without our masks on if we were vaccinated. Maybe it was 6 minutes, but it didn't seem much longer than that. I think I managed to get one restaurant in during that period of time. Well, I'd like to think that we get back to that we close that front door. It's nature, it's science, it's virus, it's vaccine. It's not unusual or unpredicted to have the antibody levels in our body drop. The other thing that happened is that the virus took a turn for the worse and became much more rapid in terms of its ability to reproduce itself. So the combination of our own immune systems getting a little tired and the levels of everything waning and the increase of the amount of virus that was present with the Delta variant, those two things have combined to put us in this situation now. So my message again, please, if you haven't been boosted, I can't tell you individually to go get boosted. I can ask you to speak to your doctor. That's the message from the task force. Boostering is a way to protect yourself, and it's a way to protect everyone around you, because it's never about just yourself. It's all of our obligation to protect everyone around us. There are people who will never be immune from this virus, and we have to do as much as possible to annihilate this virus. And I think that pretty much sums up. I took a little more than the 2 minutes I promised myself.
Fine.
But I get fired up when I talk about this.
We need the fifth. Thank you so
Shabbat
much.
Shalom, everyone. Thank you for your
This man who's busy all day long dealing with this at the hospital has been giving an enormous amount of time to us for all of you. So we're very, very thankful, Dr. Krinsky. And now we have announcements.